friendly neighborhood PhD, and you're listening to the Tide Pod. Well, hey everybody, it's another episode of the Tide Pod. Today I'm joined by Jennifer Hunter, and definitely looking forward to getting your thoughts on, on disability and your journey going forward. And I have to ask you too about the Zebra Unicorn Project and kind of what was behind all that too. So it's great
Great,
to have
sounds
you.
good. Thanks for
Yeah,
having me, Ty.
yeah, definitely. So I guess first question, kind of a somewhat of an icebreaker thing, but if you have like if you could choose a song, or if you maybe had a song in your childhood that kind of resonates with your life story, or it could be one you just go to, whenever you really, really need to listen to something you enjoy. And I know that's a hard question.
That's a tough question. That's like asking me to choose a favorite child.
Ooh, yeah,
I mean,
that's
I'm
rough.
big into music and I have really
Yeah.
eclectic music taste.
Okay.
I grew up listening to like 60s rock and classical.
Mm, very
And
diverse
I
taste.
grew up in the 80s and 90s. So,
Yep.
the first thing that popped into my head was Walking on Sunshine. That always just,
That works.
I love it. It makes me happy.
Yeah, that's a perfect choice. I feel that one.
Yeah.
But yeah, sometimes that's the hardest question of the whole podcast is when we have to decide on music. But no, that's a good one. So first, I wanted to dig into a little bit of your backstory. Do you want to just share kind of a brief overview of what your life experience has been, and then we can go more detailed into diagnosis and everything after that.
Absolutely. So, I'm married, 4 kids. I have 2 sets of twins. Um, Grew up in Boise, Idaho,
Okay.
um, and I'm now living in Arizona, which is a big change. And I grew up having multiple experiences with chronic illness.
Hmm.
I was diagnosed with polycystic ovary syndrome in my teens, and then chronic migraine a few years later, and um, Graves' disease in my late 20s.
Hmm.
And then about 6 years ago, started the whole journey with psoriatic arthritis
Hmm.
and getting that figured out. And so that's kind of where my focus has been lately is the
Hmm.
psoriatic arthritis, but also on chronic illness and kind of what it's like trying to navigate and survive chronic illness. And because this experience of being physically disabled, sometimes dynamically disabled, by the psoriatic arthritis is newer to me. Um, it's something that I felt strongly about helping others with because it was such an adjustment for me to learn to start doing things differently, adapting, having tools to help me, mobility aids, things like that. And so I know what it's like, as as we all do in the disabled community, to go, from 100 miles an hour to like, what even is this now?
Right.
Yeah. So
Yeah,
that's kind of where I focus lately. Go ahead.
right. Well, it's definitely anything, progressive too, like that, where you have to
Yeah.
learn to use new tools, and that's not always easy even to know which ones you need, maybe necessarily. So it's a challenging experience for sure. But
Yeah.
with the psoriatic arthritis, like for those who don't know, what distinguishes it from maybe other types of arthritis that are out there?
Yeah, so psoriatic arthritis, often I will describe it as similar to rheumatoid arthritis because people usually know what that is.
Hmm.
It's an autoimmune disease, it's inflammatory, it's progressive, and it attacks the joints and the tendons and ligaments, so the connective tissues um, in and around the joints. So you can have inflammation in those tendons that is referred to as enthesitis, or you can have joint pain, or you can have both. And then there's also the psoriasis component, which not everybody with psoriatic arthritis has. Some people have skin psoriasis, some people have scalp psoriasis, or both, and some have none at all that they're aware of. And it can
Okay.
attack like your fingernails, and then of course inflammation can attack anything in your body, organs, etc. And it is progressive.
Hmm.
Many of us have mild psoriatic arthritis in the beginning, and within a couple of years have moderate or even severe psoriatic arthritis. So it's one of those diseases that as soon as you know what's going on, you want to attack it with everything you've got.
Okay. And what is there any sort of treatment regimen, or like what kind of things do you need to do to try to manage and minimize, I
Yeah,
guess, the progression?
yeah, absolutely. So there are usually you'll start with a rheumatologist with oral medications. They're called DMARDs, disease modifying. I forget what the rest of the letters
Love
are.
the acronyms though, don't you?
But you start usually with oral medications that are a little bit lower risk. And if they don't work, and often they don't on their own. Then they move you to biologic injections or infusions. You have to be really careful as you're out in public about what you might be bringing home with you.
Right. I was going to ask about, the whole idea of catching viruses or anything, or like, what, I'm sure COVID probably brought a whole host of challenges and anxieties about that too.
Yes, yes, absolutely. We're one of the communities that will advocate the most strongly for continuing to have a COVID vaccine and
Yeah.
getting those like flu vaccines, et cetera. Right now, measles is going around
Mm,
Arizona. And, of course, I was vaccinated for that as a child, but sometimes that vaccination doesn't carry all the way through adulthood. And so then there becomes this whole thing like, if I were to need to have a booster shot, I can't do that. I can't do a live vaccine while I'm on the medications I'm on. So then would it be
yeah.
worth going off my medication for a
Right.
little while and those symptoms coming back in order to make sure that I'm covered against measles, which could really do some severe damage? It's complicated.
Wow. Right. I
Yeah.
mean, that's that constant worry of what's going around, what someone could bring home
Yeah.
or give to you. I mean, like that, do you feel like it's almost been sort of isolating? Like maybe you decided not to go out as much or anything like that?
It can be. It can be. Absolutely. I mean,
Hmm.
it's a balancing act for sure. I'm very careful about washing my hands.
Hmm.
On planes, I usually will mask because there's, you're breathing that
Such an
recirculated air.
enclosed space. Yeah.
Yeah, absolutely. But it's also difficult. I mean, I have children who are in high school and are going to school and bringing home whatever is out there.
Hmm.
Um, so I feel like I've had to really walk a line of still having a life and not being completely isolated and yet
Hmm.
being as careful as I can be in the circumstances I'm in.
Right. Right. That makes sense. And it's, yeah, we're worrying about, whatever bugs going around is such a hard
Yeah,
thing.
yeah.
Um, I'm curious as far as like your like diagnosis process and everything through the years with these diagnoses you were mentioning, like what has it been like with finding healthcare, navigating each one of those? Like has the health situation been better as far as helping you to find the treatments and everything you need, or and I know it's a big question, like the evolution
No,
of yeah.
yeah, it's been complicated, particularly with the psoriatic arthritis.
Hmm.
There was a move between Idaho and Arizona, somewhere in the middle there, but
Hmm.
um, I found that when we moved to Arizona, it was much easier to find the help that I needed. Um, Idaho, even living in Boise, which is the capital, and a couple 100,000 people, there
Uh-huh.
just are not very many options for rheumatology. And when I first started having symptoms, we weren't really sure what was going on. I started actually with neurological symptoms, which is unusual. And I had an attack kind of right before COVID kicked off, like
Hmm.
January, February of 2020, where I was having progressive neurological issues. I was having intense fatigue, and then I started having like shocks and
Hmm.
burning sensations. Um, I was occasionally having tremors, and like my limbs would move themselves a little bit.
Hmm.
Um, Really scary, and we didn't really know what was going on.
Uh-huh.
And I got tested for every vitamin deficiency, thyroid issues, MS,
Hmm.
spinal stenosis, all kinds of things, and we couldn't come up with a solution. And I was seeing a neurologist who'd been taking care of me for quite a while for
Hmm.
my migraines, and he got really frustrated. He got really frustrated with the whole process.
Hmm.
And that when we didn't have obvious answers from the testing, I wanted to pursue something else. Were there more tests? Was there another specialist he could refer me to? What could be done?
Hmm.
Um, and he absolutely blew up at me. I think he was just kind of out of ideas and it was probably a
Hmm.
bad day, but it was upsetting for me that he
Right.
would blow up at me and be like, I don't
Right.
know what you want me to do. He's yelling, what do you want me to do? I
Blaming
was
you
like,
almost for
Yeah. And
yeah.
he ended up sending me away with antidepressants
Wow. Okay. Well, that
and kind of a maybe we can refer you to Mayo, which of
wow.
course, right pre COVID never happened. Um,
Yeah.
it was really upsetting and it made me very wary of advocating for myself with medical practitioners for a while because
Mm.
I was really concerned that I would come across like I was pushing or like I thought I knew more than they did and that they would get upset again. And so the first couple of years of dealing with the obvious arthritis symptoms, once things started to kind of swell up and then respond to prednisone a little bit, and
Mm.
it became obvious it was rheumatology related, um, I was very cautious about advocating for myself with my new rheumatologist, who was very conservative, um, and not treating things as aggressively as I would have liked, but I kind of allowed it because I
Right.
just didn't want to have a situation like that again,
Was that
particularly. Go
all
ahead.
that experience part of the reason that you moved to Arizona, or was that a different?
It was not. That
Okay.
was a job move for my
Okay.
husband.
Okay.
Yeah, but it ended up being absolutely the best thing that could have happened to me because my neurology team and my rheumatology team in particular have been just really incredible about aggressively pushing the kinds of treatments that are actually really helping me after
Hmm.
years of struggling. So I've been really
And
grateful for that.
you mentioned prednisone. Like, what was your experience with that? Was that something to just try to help, like, with inflammation, or?
Yeah, it's something that gets used quite a lot with
Hmm.
arthritis when you're having flares. But when I first started having symptoms in my hands and feet, they were getting really swollen and puffy, very stiff in the mornings. And my GP was like, you know what? Let's just try prednisone. If it responds to prednisone, then I think I know where to send you, what we
Uh-huh.
might be dealing with. And it did. Um, prednisone, as you know, it can be complicated to take.
Yep.
Can mess with your adrenal system, can mess with your weight. For me, it messes with my moods. It makes me really aggressive and angry, which I don't like. So I try and avoid it as much as I can. But I definitely will take just like a little short course with me anytime I'm traveling
Uh-huh.
and going to be on my feet a lot because otherwise I will be disabled partway through my trip. Um, Occasionally, I'll have a joint that just is not responding to the
Mhm.
biologic I'm taking. We'll do a steroid injection. Um, I feel like I'm doing a lot of steroids.
Yeah. Yeah. Well, I definitely feel you on the prednisone because
Yeah,
back when I was in high school with my muscular dystrophy, like, and,
yeah,
and even to this day, that's one of the first things that gets thrown out. Well, you should try to maintain your strength with steroids, and prednisone was like, for me, water retention and weight gain and
yeah,
just that kind of puffy feeling, was just almost unbearable to the point I don't feel like I benefited at all from taking it. So it's one of those that's kind of like up and down. You don't really know if it's going to
yeah,
help, but it gets thrown around as kind of this general treatment almost for many different things, it feels like. So
absolutely. And sometimes I see that there are others have psoriatic arthritis who are being prescribed like 40 or 50 milligrams a day for months at a time. And I just think, oh my word,
that's a lot.
I would be horrible to be around if I were
It
having
would,
to do that.
yeah, you're
Yeah,
right. Yeah, I mean, symptoms alone, I think, would change your mood with that, let alone whatever it's doing,
absolutely.
like internally. Yeah.
Yeah.
So how did that feel though for you going through what you did with the rheumatologist and blowing up and everything when you found, like one of the good doctors with your new care team? Like, was it right away just like you hit it off and you felt like you were part of a team, or like what was that like
Yes.
getting there?
Yes, actually. It was just kind of funny because I just looked up the rheumatology practice that was closest to me,
Mhm.
and they just assigned me randomly to whatever doctor had the most openings.
Mhm.
And I feel like I was absolutely placed in his care on purpose. My rheumatologist is just really naturally upbeat, and so when we explained, this is what's going on, and at that point we were thinking it probably was psoriatic arthritis in
Mhm.
Idaho, but I didn't have like the definitive stamp diagnosis yet.
Right.
So I'm explaining these are my symptoms, and this is what my quality of life has been like, and it's been really stressful, and I just need some help. And I just remember him leaning back against the wall and going, we're gonna change things for you. We need to get
Yeah.
your quality of life back so that you feel like you want to be here. And here are your options. Which one do you like? I think they're all good. And,
Yeah.
I sat in his office and cried because I felt
That-
like somebody really is going to take care of me and help
right.
me carry this through the next however long, which was new. It was really nice to have somebody just feel like they had
It's
my back and they were going to help.
right. Right. No, I mean, that's like one of I think the biggest anxieties and stress points for anybody that's trying to get diagnosed and treat
Yeah.
anything is like if you're with a doctor or care team that they're not open, they don't like treat it with empathy or and like involve your input because you're the one going through these symptoms, and so it's just like what would the world be like if there were more doctors that would
Yeah.
sit back and listen and be like, here's the options and we're gonna figure it out, like
Yeah.
that's
It's,
yeah,
it's life changing.
it is. Yeah, it
Absolutely.
really is. And even like the mental health side, I would imagine like that was automatically better.
Yes, for sure. And I mean, there's still, I actually did some behavioral therapy for a while because,
Mhm.
there's a process
Right.
and some grief involved in realizing that your life is not going to be what you thought it was going to be, and it's not going to look like everybody else's.
There's
Um,
definitely some trauma there for sure. Yeah.
yeah,
Yeah.
absolutely. Absolutely. That was really beneficial for me. But yes, of course, knowing that you've got, not just family and friends, but also a medical team that you're not going to have to argue with.
That, I mean,
It's a
what a
huge peace of mind.
concept, right?
Yeah, yeah.
Yeah. And how did you find a therapist? Like, how did that go? Did it help you quite a lot, or was it something you're
It
not sure?
did.
Yeah.
Initially I started seeing her because one of my family members was really struggling with their mental health,
Oh,
and I needed a little bit more support to help that person. Um, it was becoming very stressful for me, and it set off a major flare.
mm,
And the more I talked to her about what I was struggling with emotionally and this stress and feeling overwhelmed, the more she started kind of pulling out of me what I was also going through physically.
okay.
Um, and so I didn't go into it with that goal, but it was really interesting to kind of process through that and talk to her about, the things I felt like I was missing and the things that I'd really never, I think, processed myself, like never allowed myself to think
Mhm.
about. It was really, really helpful. I saw her for probably only about 6 months, but just
Okay.
enough to kind of get me through that
Do
period.
you feel like that's something you could like tap back into here and there as you needed, or like do you feel like it ran its course pretty much?
I think I think there will probably be times
Yeah.
when I need to go back to that. Absolutely. She taught me
Yeah.
some good skills and helped me put some things into perspective and helped me understand kind of where some of that fear was coming from. I had a great grandmother who had ALS, and I watched
Mm.
her progress through that through most of my life and she passed when I was, I think, 21. And that was formative, to see somebody really struggling and kind of
Definitely.
eventually trapped in her own body. And I
Right.
think that triggered some of that for me. Like, is that what this is going to be? Am I going to be trapped?
Hmm.
Um, yeah, so it was really helpful. So it's nice now to be able to look back and see, well, there were a lot of things she could do. And she had a
Yeah.
huge impact on me as a person, despite her disability. And to be able to kind of realize, okay, I'm not who I am inside has not changed just because my
Mm.
body is not behaving.
Right, right. And you're right, that is something that's tricky to come to terms with, like these physical things happening and how are you going to respond? And like the mental side is so interwoven with the physical. I mean, and
Yeah.
it's a lot of people I think maybe think that it's not like there's not a mental side of or mental component to dealing with these, but there is
It's
obviously.
real. Yeah,
It
it's
is, it
heavy.
is. So, probably something I realized later in life too is like you need to work on that other side a little bit
Hmm.
more, maybe to compensate for the changes or progression going on. So
Yeah.
yeah, yeah. And with your was it your great grandmother or great great?
Hmm.
Okay, so your great
Great.
grandmother
Yeah. Great.
dealing with ALS, like what was your experience like with her? Like, did you spend a lot of time together, or you feel like you kind of learned a lot from what she went
Yeah.
through?
She lived in town near me.
Hmm.
She would have me over, she and my great grandfather, for sleepovers, spend the weekend with
Hmm.
her. Um, it was always interesting. You know how when you're a little kid, everything seems kind of bigger and
Yep. And
new
more fun,
environment is super
probably.
interesting. But she
Yeah.
had a room full of like PT equipment that she called her torture chamber.
Good
And
one. I like
you know,
that.
yeah, she would go in and ride her stationary bike, and I'd work out on something next to her, and I thought that was fun.
Mhm.
She, I'm sure, thought it was miserable, but
But at least she had you there with her, though.
yes, yeah, we spent lots of time together. And we would go run errands together. She couldn't drive at that point, but
Mhm.
she'd go out to eat, things like that. She just always, I think she wanted my life to just be a little bit more magical, and whatever she
Mhm.
could do to kind of make it that way, that was her goal.
Mhm.
And I really admire that now, looking at what she had to be going through physically and emotionally. That had to be a sacrifice of energy for her.
Mhm.
Um, but it was important to her to be connected to me. And I love her all the more for that.
I mean, that time together when you can have that with, grandparents and great grandparents, I feel like it's just, I mean, that's such a good experience growing
Yeah.
up, I think. And yeah, but being able to, I guess, be experienced or learn from someone who was obviously going through severe disability, like how did that, do you feel like it kind of set the stage for you maybe thinking or processing in a different way as opposed to if you weren't experience with that?
Yeah, I do. I mean, I grew up thinking it wasn't that weird for someone to be using a
Mm.
walker or a scooter around the house. Um, she had issues later on with, self-feeding,
Yeah.
things like that. And it just became part of life. I just kind of assumed that was what aging was like for everyone.
Mhm, mhm. No,
Um,
that's
but
really
it
good
wasn't
though.
scary.
Yeah. No,
And I think
I
that was
think a
important.
lot about that with my disease and everything. And that's kind of at the point where I'm, not able to feed, or like the daily caregiving things are really big. But like I have a nephew who's a little over 4 now, and I just think that when kids grow up around disability and don't think of it as being so strange or different, like I feel like that perspective is really valuable as, as they grow up and are around other people. So I'm always interested
Yeah,
kind of in that dynamic, I guess.
absolutely. Absolutely agree. What a gift to your nephew.
Right, definitely,
Yeah.
definitely. But no, I wanted to actually ask you about your kids and how like life has been, raising like 4 kids that way, and 2 sets of
Yes.
twins. Like that has to be really fun and chaotic, I would imagine.
Yeah, it is always entertaining.
Yeah.
I'm a little bit of a polycystic ovary syndrome success story because I got pregnant with 2 sets of twins naturally,
Mm-hmm.
which when you have PCOS, they will often tell you, getting pregnant may be a whole issue. You may need
Mm-hmm.
help, and it's possible it won't happen. And I grew up with that mentality, and then all of a sudden I've got two,
Wow.
and then all of a sudden I've got two more. They're 7 years apart, so I had a little breather in between.
That's
Um,
good.
yeah. It has been really fun, but it has been interesting because I have the kind of personality where I'll just wake up one morning and be like, you know what we should do? We should go on a road trip 4 hours away and check out
Uh-huh.
this cool thing. So my kids grew up feeling like you never know what mom's gonna do, you know. And then I had a couple of years, well, more like almost 4 years, where I really did not have the energy to do any of that. It was very
Mm,
difficult for me to even get out of bed. Um, Things like taking care of the dishes. That might need to wait a day or two.
right.
And they got really good at spotting when something needed to be done
Mm-hmm.
and just taking care of it for me. They're still just happy to run up and downstairs if there's something I need.
Yeah.
Stairs are difficult for me. And the thing actually that's been the hardest for me is that I can tell now that when I have little micro expressions, I'm trying to keep from them that I'm in pain or that I'm struggling or that I'm frustrated. They know they've zeroed right in on mom's face does this little thing and
Mm-hmm.
she's not okay.
Face
And
reading.
yes, and they're so compassionate in that, they want to know what I need or how they can help me.
Mhm.
But it breaks my heart a little bit that they know that's what that means. But
Right.
I think overall, it's been a really good experience for them. They're extraordinarily empathetic children and young
Mm-hmm.
adults at this point. So I think that's been helpful.
Yeah, yeah, and they're spreading that. I mean, like they're,
Yes.
bringing that into the world too, and kind of sharing that empathetic view, I guess. But I'm curious, like your older kids, were they helping with your second set of twins when they came along? Like, were
Yeah.
they kind of your own? I mean,
Yeah, they
like little
absolutely
caregivers, yeah.
helped. Yeah. I mean, at 7 years old, they're old enough to really understand and
That
remember everything that was going
right.
on. My second set, we had in the NICU for about 6 weeks. So that was
Mm-hmm.
kind of tough, parenting through having two babies in the hospital and two children who needed my care at the same time. But once they were finally able to come home, it was like my boys are the two
Mm-hmm.
oldest. They're identical twins.
Hmm.
Um, it was just like their dream had come true. They had little people they could help take care of and, teach all of the cool stuff that they knew. And
Yes, exactly. Yeah, yeah. Any getting into trouble or mischief with that too? Like, did they teach their younger siblings?
um, not
Yeah,
too bad.
that's good.
I'm lucky that my first set, they're very low key personalities for the
Mm-hmm.
most part.
Yeah, yeah.
Not the kind to like bicker and argue and get into trouble too much. I
Hmm.
do have one daughter in my younger set, and she was a handful as a little person.
Yeah.
So they helped me a lot with that. But nah, they've really actually
Been
been
good.
very easy, all four of them.
Yeah, that would be really great, I think, to have that many, kids going around like helping you with, I mean, just like having that
Yeah,
family bond with, with
yeah,
them. And I mean, like navigating life with, chronic illness or dynamic illness, whatever, like it had to be better, I would imagine, having them and your husband kind of that support system there.
absolutely,
Yeah.
absolutely. I don't know. Boy, it would be tough to do this without all of them. It would really be tough.
Hmm.
Yeah.
And so now is are your older kids in college age at this point, or where are
They
they at?
are, yeah, they're juniors in college, and doing really well,
Hmm.
happy and dating and hopefully learning some things.
Nice. Being independent.
Yes.
Yeah.
Yeah, they're doing it well.
Yeah.
Um,
Yeah.
yeah, and my younger ones, are still in high school, just
Yeah.
getting to the point where they're having to think about all of that.
Oh wow.
Yeah.
That's a challenging time for sure.
Yeah.
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 Yeah. I'm curious, like what kind of areas did they are they passionate about, like a career in, or like what are their kind of plans or goals, I guess, going forward?
My two older boys, one of them he's a psychology major. He wants to go into neuropsychology.
Mhm. Okay.
So he's got a slog ahead of him. I think he's probably looking at a PhD. So
That
several
takes
years of
some
school.
time. Yeah.
Yeah, yeah, for sure. Um, and I think he's hoping to get a little bit of practical experience as well,
Yeah.
somewhere between undergrad and his graduate degrees. But
Hmm.
and then his brother, he's just kind of not sure. He's waiting for the thing to jump out of him that he wants to do. He's an
Yeah.
English major right now. He knows he wants to do something, you know, maybe law, maybe he's
Mhm.
not sure. He's just not sure.
Okay.
Something with something beyond that, but just feeling it out.
Yeah,
That's kind of more
I
his
get that.
personality. Yeah.
Yeah. Yeah, that's really cool though, to kind of, see like where each of them are going. Like even being twins, probably they're so unique and individual, I would think too.
Yes.
Yeah.
Yes.
Yeah.
Absolutely. Yeah. From the minute they show up on your doorstep that they are completely different human beings. They
Right
just
away
have
you realize, yeah.
totally different personalities. Yeah.
Yeah. Yeah. Oh, that's really great though. So
Yeah.
like are there or have there been like school events or activities that like you have gone to over the years with your kids, and like what was that like?
Yeah. So, um, let's see. So one of them is involved in like photography and that kind of thing, and
Okay.
he loves, um, he plays the guitar. He loves that. They both of the older boys were involved in band for a little while, but
Hmm.
the other one branched off into more choral music, that kind of stuff. And then my
Okay.
little people, my younger son is also heavily involved in choir,
Mm.
has a beautiful voice, and my daughter is extraordinarily artistic. She
Okay.
just came with this gift to be able to draw or paint
Oh, that's
whatever
really
she thinks
cool.
of. So she's big into that, but she's
Yeah.
also a huge animal lover. So I'll be really interested to see whether she kind of goes the art direction or like
That'll be
maybe
fun. Yeah.
veterinary. I don't know. We'll
See
see. Yeah.
which way she goes. Yeah.
Yeah.
Have you already kind of like in your mind started thinking about like when your younger kids have graduated and moved, like what that like life is going to look
Yes.
like after?
Yes, I definitely have. It's interesting you should ask. We are starting to look at house plans for our
Mm.
next home. We're
Mhm.
intending to build a home within the next few years, and we're thinking about, adaptive design
Mm,
and
right.
what kinds of things I need to have in place so that I can do a lot for myself.
Hmm.
Um, and then I'm also just really lucky in the husband that I have. He's just, he's always been the kind of person to drop everything and do whatever you need,
Hmm.
which when I was fully able bodied irritated me a little bit. I was like, I'm fine. I got it. Leave me
But
alone.
now you appreciate it more.
Now I'm
Yeah.
really, really grateful for that.
Hmm.
I think he grew up watching his dad uh, be that support for his mom who has rheumatoid arthritis
Oh, okay.
as
Okay.
well. And so that's just how he was raised. You step in and you help with whatever needs doing. Um, and he's amazing to just support me and help me with whatever I need, and better than I am at identifying when there's a need.
Well, that sounds like very like complimentary for both of you on
Yeah.
everything. So yeah, that's cool. So you're building a brand new like are you going to completely design it or like be involved with every part of the
Yeah.
process? Yeah.
Yeah. That's our intention. And it's tricky because, we're trying to decide whether we need to have space for the kids to all come home
Hmm.
or whether
Hmm.
we just want to go smaller and have something that's a little more manageable for just the two
Right.
of us. Or
Do you have a way you're leaning, or are you still kind of like
I don't
backward?
know. It's
Yeah.
really hard.
I would think that too. Yeah.
Yeah. Thinking ahead, I mean, I hope there are grandchildren at some point and I hope
Right.
they would want to come
Right.
and stay with me. But then
Or
part of
you
me is
want a
like,
big
there's
enough house for
Airbnb
that.
everywhere. I don't know.
That's true. Yeah, you're right. You're
Yeah.
right. It's like, do you want to be like traveling grandparents or
Yeah.
hosting grandparents? Yeah.
Right. Exactly. That's a good way to
Yeah.
put it.
Yeah. But the home thing really intrigues me because my parents actually built my childhood home, from
Okay.
basically from scratch, and designed a
Yeah.
lot of that too. And so like that's a really cool like process to see and be involved with. And I was just
Yeah.
old enough that I was aware of a lot of what went into it too. And it's just like it's a big endeavor. for sure.
Yes, it is. Lots and lots of decisions. We
Yeah.
have built a previous home, but the nice thing is my brother was the contractor.
That helps.
So
That
it was really
helps.
nice to have somebody, who knew the whole process and could just kind of help me out. Like, do you want this or this? I don't know. What do I want? You want this.
Yeah,
Um,
yeah, suggest what, yeah. That's a good way to look at
okay.
it.
Yeah, now we're in the wrong state, so
Are
that's
you
not
in
going to work.
any into any of those like home renovation shows or anything like that? Have you taken
No.
inspiration from? Yeah. So
Yeah.
it's just all you and your husband's ideas and designs and
Yeah, we're trying to put
nice.
together everything we think we would want and
Yeah.
which things are actually important and which things would just cost us money and not really be
Yeah. I'm
worth
curious,
it.
like what's highest on your list for like adaptive type designs
Single
there?
floor,
Yeah.
single
Yeah.
floor, absolutely, and wide doorways and halls,
Hmm.
wide enough that if I ever needed like a scooter or something, I'd be able to get
Yeah.
around. Um, those are probably the main two, but things like blocking behind the walls for if we need to install grab bars.
Mm-hmm.
Oh, what else? I don't know. I've got a whole list somewhere,
Yeah. No, that's really
but I
cool. You know, like
definitely
to
want to be able to,
something you
age
want to
in place.
plan. Yeah.
Yeah,
Yeah, you
yeah,
definitely want to do that. Yeah. Well, that's exciting though to have that kind of as something that you're working on as your kids are all getting to college and everything. So
yes,
that'll be cool.
yeah.
I did want to ask you a little bit about your zebra unicorn project, like what that is and like how it came to be and everything.
Okay, yeah. So it started because a few years ago, we were discussing the possibility of me being diagnosed with Ehlers-Danlos syndrome,
Mm,
which I have been diagnosed with at this point. I've been diagnosed with a hypermobile type.
okay.
And I didn't understand what that really would mean for me. It was just kind of like one more thing on top of the arthritis.
Hmm.
And I didn't get, you know, all of the different ways it can manifest in other people. And does this mean things are going to be even worse going forward? Or is it just something that kind of in the background I have and I need to be
Hmm.
aware of? Um, and zebra is, something that's used as a little bit of a mascot in the rare
Right.
disease community
Hmm.
because, when you hear when you hear hoofbeats, think horses, right? But sometimes it's a zebra.
Hmm.
Um, so you'll see zebra a lot on people with EDS or
Yep.
other rare diseases. The unicorn thing comes from when I was trying to explain to my new GP here in Arizona that when we test my thyroid, we have to test not just the TSH and T4, like often will be, often that's the
Uh-huh.
order. My T4 is always normal. It's my T3 that's weird because why not? um, and I was explaining that to her, and we had been going through these are all the specialists I see. And oh, yes, if you're going to do a thyroid draw, we need to do this because I'm weird. And she just kind of chuckled and she said, just, kind heartedly, you're just a special little unicorn, aren't you?
Hey, you took that, you ran with that one, right?
Yeah.
Yeah.
Yeah. So I was like, zebras and unicorns, we got to stick together. Um, but as I started kind of exploring the EDS community, I realized there was really good representation
Hmm.
around EDS,
Hmm.
but there were some common issues that kept cropping up among people with different chronic illnesses that I could identify with as a migraine patient or as a PCOS patient or as an arthritis patient. And so, what I want it to be is a welcoming community that kind of discusses the daily struggles of living with chronic illness, both physical and the logistical and the emotional. And I've only really focused on psoriatic arthritis lately because it's the thing that's the newest and most difficult for me.
Right.
But I'm still living with, chronic migraine and I'm still living with thyroid issues that I have to manage a little bit and, hormone imbalance stuff it's just kind of part of the background noise at this point. But yeah.
I think that's something too that a lot of people don't realize with rare disease and everything is like oftentimes there's not one diagnosis or like
Hmm.
one thing going on. There's like a whole like list of things, and that's like you've got to find that balance of managing all of them, and
Yeah.
it's got to be like a full-time job and then some.
It can be. It
Yeah.
absolutely can be. And I have had months where I'm like, I've got, two doctor's appointments a week every week of the month. I'm just like, man, it's a good thing I'm not working outside the home because where in the world would I find
Right.
the time for all of
I mean,
this?
it's exhausting to
Yeah.
to have to schedule and plan around all of those too. Yeah,
Yes.
yeah. And
Yes.
so like
And argue
what?
with insurance and
Oh, that's a whole that's like a whole podcast by itself,
yeah.
obviously, I
Yeah.
think. Yeah. 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 What is like the overall mission though of that project with the zebra unicorn thing? I'm like,
The tagline I've settled on is help and hope for chronic illness.
mhm.
I can't speak for chronic illness patients.
Yeah.
Um, and I feel like when you're newly diagnosed with anything, it just can feel really overwhelming.
Hmm.
And so my aim has been to focus on kind of the frequently asked questions about diagnosis, covering kind of the basics of how to manage all of the logistics of having these diseases, and
Hmm.
but also to do it in a way that's optimistic and upbeat without being fake and pretending that this isn't hard.
Toxic
Because
positivity,
sometimes,
basically.
yeah,
Yeah.
yeah, exactly. I just think that's not helpful at all. But the days that are good are worth pointing out, and the ways to make your life easier are important. And so those are the kinds of things that I want to share. Like, here's what I do in order to function sort of normally, and and not I think a lot of newly diagnosed patients feel like, well, it's a progressive disease, it's only going to get worse from here, this is bleak, what's
Right.
the point? And I don't want patients to feel that way. I want them to see, like, look, a full life is still available to you. It may be
Right.
different than you imagined, it may be modified, but there's a lot of living left to do even within this
Mhm.
space.
I love that. I think the quality of life for each like individual person, is can be so specific, and hard
Mhm.
to like you can't assume that it's going to be the same even with the same diagnosis, but
Right.
at the same time, it's like there are tools, there are ways out there to navigate it and have a full life and enjoy what you're doing, So I
Absolutely.
think that that's exactly kind of how my process has been with, with everything. And so like that's sort of giving back and helping and not like pushing things or like making people try stuff, but just like sharing just your experience and like here's what works and how I've managed, like that has to be really helpful to I think quite a few people.
I hope so. I hope it is.
Yeah, yeah. And,
Yeah.
and so like what does it look like as far as sharing that information? Like is it through website? Do you have like blogs or meetings or what is that whole structure kind of like for you?
Yeah. I do have a website that's kind of
Mhm.
an aggregate for everything I'm doing elsewhere
Okay.
on the internet. I'm mostly using Instagram as that outlet to kind of
Hmm.
reach people, and copying things over to the website and YouTube. But I've focused for the last couple 3 months on a little series that I'm calling PSA Q&A,
Hmm.
where I'm just tackling like one of the most frequently asked questions at a time and going through, this is my experience, this is my
Hmm.
understanding, not a doctor, but here's how I manage this kind of situation. And then we're able to, kind of discuss in the comments, and always am looking for input on what else people want to have answered.
Hmm.
So that's kind of been the main crux. But I also sometimes will just post like, here's what a doctor's office visit looks like, or
Okay.
um, I'm struggling today and I don't know how to handle it. And, ideas, anyone, what are your
Yeah.
suggestions? Because I really want it to just be a slice of my real life.
Well, it is like a community too, though, where I think it's you're showing your authentic experience as well with your day-to-day things too, and I think that's just as valuable as getting other people's thoughts on it too. It's like you bring all these stories together and hopefully it, creates a network where people can feel supported for sure. So like
Yes.
with your experience with social media, like did you feel like you found a sense of community or did you go there looking for feedback or answers with anything you were going through with your diagnosis or
Yeah, I definitely feel like there's a sense of community. There
Mhm.
are a very few other sort of what you might refer to as influencers in that
Mhm.
space, specifically talking about psoriatic arthritis.
Mhm.
But because there are so few of us, um, we're all really supportive of one another, and, kind of commenting all over each other's things. But it's been so great to learn from other people, like, oh, oh, I could be doing that. That's a really good idea.
Right.
And I love that. I love that about the internet, that it allows us to connect with these people who they're nowhere
Exactly.
near me physically, but they're a part of my little community.
That's such a cool thing too. It's like a kind of a small world once you, kind of
Yeah.
find the people that are out there and it's like you right away there's that understanding and if there's something weird going on that, you're struggling with, it's like, yeah, I'm just gonna put that out there and somebody else will have an idea or thoughts on it. So like that's such a great thing, I think, to have that resource that I don't even know, like probably 20, 25 years ago, I like that wasn't, I mean,
Yeah.
I was in the days of like MySpace or whatever, and that was not the intent of social media, but
For sure.
yeah,
Yeah.
yeah,
That would be really lonely.
it would, yeah, yeah, for sure.
Yeah.
Then I sure appreciate you sharing, all those stories and everything. And I definitely want to, connect people to your website and resources if they, need any kind of assistance with psoriatic arthritis or, I'm sure you have a fully compiled slide of all these experiences for sure. But
I do.
yeah, it's been really great to visit with you, and I definitely
Thanks.
will look forward to sharing.
Thanks, Ty. I really appreciate it. It's been really fun to talk to you.